It's altered everything in my life.
I saw too many patients not getting better.
A 13 investigation, 6 months in the making. An infectious disease doctor who voluntarily deactivated his medical license while under investigation for malpractice is now reactivating it to help during the coronavirus. A lot of patients and healthcare professionals say that's a bad idea, telling 13 Chief Investigator Darcy Spears he's already hurt too many people.
It's altered everything in my life. I don't feel freedom, you know.
Judy Hogue can barely dress herself. Sometimes she can barely stand. She's only 70, but can't get around without a walker, can't drive, and has permanent damage to the part of her brain that controls hearing and balance.
I can't even pick up a box with 2 hands. All the little things you take for granted are gone.
All because of treatment for an infection after a dog bite in December 2018. She went to Dr. Deval Shaw, the owner and supervising physician of Clinical Infectious Disease Specialists, or CIDS. Judy went daily to the clinic near Smoke Ranch in Tenaya for intravenous antibiotics.
What kind of care do you feel like you got?
Careless care, I guess. I don't know. I mean, it certainly wasn't appropriate. It wasn't good.
The side effects sent her to the emergency room, but CIDS staff kept her treatment the same. Medical records show a permanent deficit to the vestibular portion of Judy's brain that doctors say is due to antibiotic toxicity.
Everything I do is a struggle.
Carrie Catalano knows about struggle too. She lost her daughter Kaylee Drew, also a patient of Dr. Shaw's. The pain too overbearing for her to discuss, opting to make a statement through her lawyer.
Her statement was, "How would I describe my daughter Kaylee? I never thought in a million years I would have to write this. I'm not supposed to outlive my children."
Matthew Hoffman represents Catalano.
My beautiful Kaylee was and is a strong, articulate, free-spirited young lady who always had a smile on her face wherever she was. On February 13th, 2019, myself and my family's life changed forever. My new normal is a life without my daughter, all because a simple phone call wasn't made. A day doesn't go by without replaying Kaylee's last week of life. My heart hurts thinking about it. If only that phone call was made. If only an emergency contact was called. If only I was called. If only.
Kaylee was 24 years old when she died. Court records accuse Dr. Shaw and his physician's assistant of failure to review her lab results, which showed critically elevated levels of potassium in her blood.
And according to our expert, everybody in the medical profession knows that that is a devastatingly awful, extremely high critical value.
Kaylee's family says no one called her or them about the results or the imminent danger to her health. The phone call from a PA came one day after Kaylee Drew died.
My client's daughter had critical values that were in black and white, and had they been relayed, could have prevented a death.
Kaylee's family is now suing Dr. Shaw. Judy plans to do the same.
This is certainly negligent medical care.
Andrew Thomas is Judy's lawyer.
This is a betrayal of trust. A patient's supposed to be able to trust her doctor, and what happened to Judy was a betrayal of that trust.
A betrayal described by some who worked alongside Dr. Shaw. 13 Investigates has spoken to numerous medical professionals affiliated with CIDS, including Dr. Christy Kaminsky, who worked in the clinic's wound care department. She quit because of what she saw.
As doctors, we take a Hippocratic oath, and our first thing is to do no harm. And I saw too many patients not getting better.
The State Board of Medical Examiners is investigating Dr. Shaw based on complaints filed by other healthcare professionals. This one describes fraudulent practices at CIDS, naming 22 patients who allegedly received substandard care that led to emergency room visits, no improvement or worsening illness, unnecessary medical costs, and unnecessarily prolonged treatment.
Someone like this should not be practicing medicine, in my opinion.
The state filed 2 pending complaints, formally charging Dr. Shaw with malpractice. Both involve patients who died. Dr. Shaw declined an on-camera interview on his attorney's advice, but his lawyer sent a statement which says in part, The well-being of Dr. Shaw's patients has always been his paramount concern. Dr. Shaw recently reached a settlement with the Board of Medicine's investigative committee, which is pending final approval by the full board. He intends to work hard to earn and keep the trust of the board and the public. In order to demonstrate his sincerity, he has stepped away from his practice and is currently devoting time and resources on a volunteer basis to assist with the response to the unprecedented COVID-19 pandemic. He values the opportunity to treat the citizens of Nevada.
Allegations of substandard medical care is just one of the clouds hanging over Dr. Shaw's practice. We've also uncovered billing discrepancies, documented labor violations, even a failed marijuana testing lab. Is the clinic putting profit over patient care? My special report continues tomorrow. Darcy Spears, 13 Investigates.